Behind every disease statistic, there's a person. Lucy suffers from a disorder affecting a part of her brain that controls movement. Before her operation, she was confined to a chair and had difficulty eating and breathing. Without surgery that could only have been developed through animal research, Lucy could have died. She now has a new lease of life. The brain is the most complex organ in our body. It is not just a sum of all its component pieces. It is much more than that. Indeed, it's one of the most complex organs we've ever tried to understand, and how it does what it does is still largely a mystery. This means that research techniques focusing on a small part of the brain or a single pathway cannot tell the whole story. To get to grips with its complexity, we need to look at a living brain, the entire brain, and how it interacts with other organs. The brain controls every aspect of our lives, from regulating our heartbeat and emotions to movement and speech. However, unlike a heart or any other organ, it can't be replaced when things go wrong. And at the moment, there are no cures for diseases of the brain. Some disorders affecting the central nervous system are genetically driven. As a child, you have no influence on your genetic makeup, which could predispose you to disorders like schizophrenia, Parkinson's disease, or Alzheimer's. In addition, any one of us could have an accident and be left paralysed.
Well, the common causes of spinal cord injury are things that could happen in everyday life. So they're things like automobile accidents, and also, for example, a lot of sporting injuries can cause spinal cord injury. If we take the famous case of Christopher Reeve, he actually fell off his horse and then developed paraplegia. But at the moment, there are a number of experimental techniques which are being developed, which may potentially be the treatments of tomorrow for treating spinal cord injury. So at the moment, the majority of research looking at spinal cord injury involves looking at rodents, in particular rats. And what we do is we look at the ability of a chemical, an enzyme called chondroitinase, which has been shown to allow regeneration of nerve fibres in the spinal cord to quite considerable distances.
When the spinal cord is injured, scar tissue forms. It is partly comprised of a cell type called glia. This acts as a physical barrier to nerve regrowth. Chondroitinase may help.
It's thought to break down the constituents of the glial scar and therefore reduce the inhibitory environment that the injured nerve fibre faces after injury. You couldn't do this on humans for a number of reasons. The first major reason is because chondroitinase is actually toxic to humans, so the doses that you would require to get functional recovery are just too great. But using our animal models, we can look at this drug and we can look at the active sites and how it could actually exert its action, and then devise an analogue pharmaceutically which could then be used in humans. The second reason is obviously that you can't look at histology, you can't look at post-mortem of patients because you have to wait a very long time for them to actually expire and then to remove the spinal cord, whereas with rats it allows us to do this over a relatively short period of time.
The same problems hold true when using post-mortem brains to study mental illness.
The drawback of studying things in post-mortem brain is that, of course, people have typically died of old age, often in an institution, and they've been exposed to 30, 40 years of drug treatment and a very isolated kind of existence. So it's difficult to find control people where all of that is matched. So you can't match for the effects of the drug, and you can't match for the effect of lifestyle in that situation.
The difficulties in using human tissues are partly overcome by using animals whose environment we can control. In the case of an introduced spinal cord injury, the animal still has normal function in one side of the body. This means that the recovery following treatment in the injured side can be compared with the normal in a series of behavioural tests.
There's something called the sticky tape test, and essentially what this involves is a piece of sticky tape attached to the rodent's paw, and it has to sense that this sticky tape is there, and because it's not very comfortable for the animal, it will then rip off the sticky tape. And therefore you can assess two things. You can assess the sensory benefits and regained after application of chondroitinase, because it can feel the sticky tape to pull it off, and also the motor responses, because in order to pull it off, obviously it needs some sort of motor ability.
The staircase test also measures limb functioning. Mice are placed inside a small chamber where they have to walk along the stationary platform to retrieve a series of tiny sugar treats. They can only use the right paw to reach the right staircase and the left paw to reach the left. Animals with a spinal lesion on one side find this difficult to do on the side that's injured. Then there's the water maze task, commonly used to assess memory impairment following stroke. Animals have to find a submerged platform hidden in a murky pool of water. They use visual cues from around the room, the position of the door or window, for example, to remember where the platform is. Once they find it, they're taken out of the pool, towel dried, and back to the cage. Those that struggle with the task are fished out after a couple of minutes. In spinal cord injury, the challenge is to regenerate the damaged nerve cells. For stroke patients, it's the opposite. Here, the difficulty lies in preventing cell death.
Stroke's a very big problem in the world. It's the second biggest killer globally, and in Britain that translates to one person every 5 minutes having a stroke. So it's a massive problem, and one of the worst things about stroke is that even if you survive, a lot of the people who do survive are left with other kinds of disability such as paralysis, impairment, their vision, their memory can be affected. So it's a very debilitating disease. A stroke's caused when the blood supply to the brain is stopped quickly and dramatically. And what happens when you get the stroke is that that region of the brain that stops receiving its blood supply stops getting oxygen, stops getting glucose, and the cells in the immediate area start to die. Now, there's nothing we can do about that. But what also happens is that subsequently there's a period of hours, which can extend to days, of what we call delayed cell death.
Barry studies the basic biology of stroke. Many different molecules are involved. Understanding what they do and how they interact may help researchers devise new anti-stroke therapies.
We couldn't do what we're doing without using animals. The brain is such a complex organ, the most complex in the human body, that you can't simply take it apart and look at individual cells. Every single one of the cells in the brain, in a living brain, has thousands of other connections with lots of other cells. And you need to keep that integrity, you need to keep those cells in contact. In the UK, there is some work going on with a naturally produced chemical in our body called interleukin-1. Now, what they found in tissue culture was that it appeared that interleukin-1 was actually protective to the cells, and it reduced damage to those cells. However, when they went on to actually look at this chemical in animal models, they found it was actually quite damaging. And had this chemical gone on to be used in humans, it could have actually been fatal. So now, thanks to this work in Manchester using animals, they've been able to develop certain types of drugs to block the action of interleukin-1, and those are now in clinical trials.
This is a new treatment in the evaluation stages. Another treatment for stroke used worldwide is constraint-induced therapy. It basically involves restricting the movement of the side of the body that is unaffected by stroke, forcing the damaged side to perform the tasks. It sounds obvious, but this simple treatment is a direct result of studies in monkeys that showed the brain could undergo massive physical reorganization in response to damage. That means over time, the nerve cells actually grow and make new connections. Stroke is a serious problem. About 10% of those that suffer a stroke are children. But in terms of the effect it has on people's lives, mental health problems exert a wider influence. At some point in our lives, 1 in 4 of us will develop a mental health problem. So how do we study mental illness in animals?
It's very difficult to model mental illness in animals because how do you model a hallucination or a delusion? And how do you model depression and feeling unhappy and suicidal and so forth? But it can be done, and the two main approaches are, first of all, to observe the effects of drugs that we know cause these disorders. So there are certain drugs that cause hallucinations and delusions in humans, like LSD, for example.
Well, PCP has been taken as a recreational drug and had been taken quite widely in like the 70s. So it was observed that individuals exhibited psychotic response very similar to that of schizophrenics. And that's why we knew that we could use these drugs in rats to model the disorder. The rat model of schizophrenia that I was using was focused primarily on the attentional deficits that are exhibited in psychotic patients. They find it in a lot of cases, they find it very difficult to concentrate on something. So I could be talking to someone and they can be distracted by the noise of something coming through the window or the lights or something else that's being said to them. So that's the part that I primarily focused on. But there are lots of other models of schizophrenia focusing on the other symptoms.
Using drugs to induce symptoms is one approach. Bill describes another which is used in studies of depression. When someone is depressed, things like having dinner with your family or a drink with friends holds no pleasure.
So we can model in animals a loss of pleasure, and one way of doing that is to see whether animals prefer sucrose to water. Normal rats prefer that. If they've been stressed in some gentle way, then they lose that preference, and that's a model for what we call anhedonia, the loss of reward. And then we can try and reverse that with drugs that may be effective in depression, and all the ones that are effective in depression have that ability. The kind of thing that's done these days is to use mild stress, a chronic mild stress model of depression, for example, where you sort of mess about with the daily routine of a mouse, so that the litter that the animal lives in isn't cleaned out on time, the water doesn't arrive on time, the light-dark cycle is messed about with, and they're isolated for a bit. There are many ways of trying to induce a state of anhedonia using rather mild and ethical kinds of stress. Well, I think for all mental illnesses, actually, the outlook has changed dramatically in the last 25 years, mainly due to improvement in how antidepressant drugs work, the development of new antidepressant drugs and the development of new antipsychotic drugs. And I mean, to see somebody just get better from a simple depressive illness, to see somebody who's floridly psychotic recover and achieve a normal life again, and to see somebody who's a manic depressive, whose mood is either up or down and it's been like that for years, and just to get the medication right is one of the most satisfying aspects of my job. And the improvements you see are just remarkable.
As we age, we're more likely to succumb to Parkinson's disease, Alzheimer's disease, or suffer a stroke. There are treatments, but there are very few cures. At the Charing Cross Hospital, Tipu is a surgeon who treats patients with Parkinson's disease. The therapy that he carries out 3 days a week was developed in animals.
Recently, really in the last 10 years, the use of primate models of Parkinson's disease has allowed us to find the central targets in the brain that drive the symptoms. And surgery, which involves implanting electrodes into this target, the subthalamic nucleus, can dramatically alleviate Parkinson's and virtually restore you to normality.
This therapy was demonstrated in monkeys before moving to patients. 1 of every 1,000 procedures using animals involves non-human primates. These are some of the reasons why they are used.
We walk on 2 legs, they do. They use their hands, we do. Their brains are wired identically. And given time, they even develop the same conditions. People say monkeys do not develop Alzheimer's. They do. It's just they don't live long enough in freedom. It's in captivity it's become apparent. Untreated Parkinson's, the 3 major signs are severe tremor, a very stiff limbs, rigidity as we call it, and a slowness of movement. They move as if they're walking in treacle. If they take drugs, for a few years they can be restored virtually to a normal state. But within 5 years, 80% of Parkinsonian patients will develop severe uncontrollable thrashing. So they either thrash about or they shake and are unable to move.
The technique is called deep brain stimulation. It gave Lucy a new lease of life. Mike Robbins is another one of more than 200 of Tipu's patients who has had the operation.
I first noticed that I had a tick in my right shoulder about 8 to 10 years ago. Rather like the type of tick that most of us have at some time or another found in their eye. But this didn't go away. It got slowly worse, so that down the right side, the first real sign that I noticed that there was something quite wrong with me was when my fingers wouldn't work. I'm a smoker, and I couldn't knock the ash off a cigarette. This index finger of my right hand just wouldn't do as it was told. And slowly it got worse, so that I then had a tremor start in my right side, and after about 18 months, my whole right side was quite a severe tremor. I was diagnosed in Shanghai, and then when I got back to the UK, a neurologist put me on a variety of drugs. None had any effect at all on my tremor, but all gave me terrible side effects. Some of the side effects were quite horrendous, that I thought that I was living inside a balloon, that people couldn't hear me in the room, and so I was taken off those drugs. And I had heard that there was surgery.
For this procedure, patients must be awake. Prior to surgery, the patient's head is screwed into a frame and they have a CT scan. The use of a reference grid helps the surgeon to know where to drill the hole.
We drill a tiny hole on the side opposite to which we want to improve, because the brain controls the other side. We pass the electrode down to target, and when we pass a current, the patient, being wide awake, can immediately show us that the tremor has stopped, the movement has improved, and there are no side effects like uncontrollable tingling or speech affectation. The electrode is then fixed to the skull with a screw. And then we do the same for the other side. So both sides of the brain are brought under control. Following that, the electrodes are connected to wires which are tunneled under the skin and attached to what is a pacemaker which lies under the skin. And you can communicate with it with an external programmer to tell it exactly which electrodes to activate and how to stimulate and give the patient the best possible reversal.
Diseases such as Parkinson's and Alzheimer's generally affect older people. The distinguishing features are the loss of nerve cells in specific parts of the brain. Huntington's disease, although not as common, belongs to the same class of disorders. It is caused by a faulty gene and runs in families. The gene mutation was discovered in 1993, but as of yet there is no cure. Sarah works at the National Hospital. She researches the disease and treats patients.
Huntington's disease is a particularly devastating neurodegenerative disease. It affects young people, but it has a slow, inexorable progression over 15 to 20 years to death. For example, if someone develops symptoms in their late 20s, they develop acquiring difficulties with speech, swallowing, their bodily functions, such as going to the toilet. They find it increasingly difficult to walk, they're unable to think properly, they're unable to communicate properly, and their thinking becomes affected, and they're difficult to communicate with their loved ones. So over that time, their life becomes really intolerable.
Mandala's son and husband are both affected by the disease. She describes how it makes her feel.
Very painful and very, very angry, because my husband got it as well and now he got it as well. And it's not cured at the moment. It's really hard to talk.
Huntington's disease usually only shows itself in adulthood, by which time many couples will have had children and possibly grandchildren. They have a 50% chance of inheriting the faulty gene and developing the disease. And there's nothing that can be done.
And I think we owe it to our patients to be able to tell them about the research that's going on, in the fact that we are able to offer them some sort of hope for a therapy. I would find it very difficult to practice and to see patients every week without being able to tell them this. Neurodegenerative disorders per se are going to be a significant public health problem and something we have to take very seriously. Statistical predictions have estimated that by 2025 there will be over 1 billion people in the world aged over 65. Age-related diseases such as Parkinson's disease and Alzheimer's disease are going to be a significant public health problem, and we're going to have an ageing population, many affected by this disorder, who are going to be a great burden on the younger society and on their families. It's vitally important that we find some sort of therapy for these disorders now, before that time comes. When you model diseases in mice, you make the mouse and put the gene that causes the mutation in humans into the mouse. So you make a transgenic mouse. It's a very kind of simplified way of explaining this. There are a number of very good transgenic mouse researchers throughout the world, and they have made models of neurodegenerative diseases that closely mimic the patient symptoms that we see in clinic. For example, in Huntington's disease, researchers have made a mouse model of Huntington's that mimics many of the symptoms I see in patients. For example, the mouse is shaky, it gets stiff, it has behavioural problems. It also, in the brains of the mice, has the changes that are seen in many of the patients' brains.
So animal models of disease help us tease out what's happening in the brain when things go wrong, but they do have limitations. Any disease is complicated and has many different symptoms. Most animal models focus on just one symptom or molecular change. It may take years to understand the basis of a small part of a disease pathway modelled in an animal. But this takes us one step closer to better patient treatments. In 2002, around 2.5 million procedures were carried out on animals. Most were on rodents. But rats and mice are very different to humans, so why not test new medicines on human volunteers or patients without doing animal testing?
I certainly wouldn't want to give any normal volunteer even a single dose of a drug unless we knew that it was really safe, and that has to be established by all sorts of procedures, some of which has to involve animal testing, and we can observe very marked behavioural effects of those drugs in animals, experimental animals, and then we can use that to understand the brain mechanisms involved and to find drugs that reverse the behavioural abnormalities in animals.
It's not ethical to take people off their antipsychotic medication and to start testing on them with drugs that might not work the same way as theirs does, or if they, it might worsen the symptoms.
Working with animals is something scientists have to ethically justify to themselves.
It's a very difficult process to decide to conduct experiments on animals, and because of the bulk of our work is to do with that, it's obviously a decision that you have to think about quite considerably. Really, what I thought about was whether it would benefit the patient and whether I could do it in any other way. So we did think about whether we could do it, say, in a dish or on some other way, like modelling or using electronic software, but it just doesn't fit to any of these, so you can't do this sort of research in that way.
The first time I had to do an experiment involving rats was very difficult, because to get used to using animals, we had to spend several weeks playing with the rats and handling them and stroking them. And when you're petting an animal twice a day, every day for several weeks, it becomes very difficult to go in there and do an experiment. And it must have taken me 2 months to go from having never handled a rat to actually injecting and carrying out experiments. My family have always been very supportive about me doing research involving animals, but my friends were less so. I had people asking me how I could do this and how I could end the life of innocent creatures and all that, but it's something I chose to do, and I did believe that it is for the greater good.
I've always had mixed feelings about using animals in research, but it comes down to a simple decision of whether or not you're prepared to do it in order to try and help save people's lives. Some of the diseases that we're talking about are so serious that there's no other way to make progress in trying to find treatments.
Some would argue that animal research is not necessary and that everything can be done with computer modelling and in-cell culture.
Even human cells are very different from the whole human being. And for example, drugs in mice that have been shown to have been of great benefit in slowing the disease down, for example in Huntington's disease, do very little in cell models. But when you give it to mice, it can extend life by 20, 30, 40%, and that's very exciting, in that if we can try and extrapolate that to humans, it could make a significant difference.
You can't walk into a hospital now, or even a general practitioner's clinic, without being cognizant of the fact that virtually everything that is offered you has been tried in animals.
If animal experimentation were banned, I don't think we'd discover any new drugs. We might be able to carry on refining the drugs that we have, but we wouldn't be able to safely administer drugs unless we could check for safety. So it's a safety issue. Normal volunteers aren't going to volunteer for a drug which might kill them.
In the meantime, procedures already developed are improving people's lives. Tipu's deep brain surgery is helping patients with movement disorders and Parkinson's disease. Mike recalls Tipu inserting the electrode into his brain.
At one occasion during the process, he said to me, "I'm just passing an area of the brain that controls sight. And I saw the most magnificent colours that you've ever seen in your life." On another occasion he said, "I'm just about to pass the area that affects your speech. Will you talk to me?" So I said 1, 2, 3, 4, 4, and I heard this reassuring voice over my shoulder saying, not to worry, not to worry. He withdrew it and tried again, and eventually passed this area. And then the next significant point was, I've got a few millimeters to go, Mike. And my right arm and right leg were shaking quite dramatically. And the moment that he touched the spot, which I'm told is about the size of a grapefruit pip, the shaking stopped immediately. I laughed, I giggled, I couldn't believe my luck. My right arm and right leg had been heavy for 18 months, and they felt as light that they were going to lift into the air.
Animal research is not an indulgence in the areas we have covered today. It is a necessary part of the advances we are having to make in understanding and treating a range of illnesses, for which there is as yet no cure.
The probe that is placed into the brain, I understand, comes level with the top of the nose and the ear. And it is connected to a battery in my chest, in my underneath the skin in my chest here. And this is controlled. I can control the amount of the voltage going in, I can control the length of time that the pulse is, and I can identify the number of times per second that it goes in. And I'll turn myself off now. So one of the problems is not only, as you can appreciate, is that you can't do very much for yourself. The whole personal hygiene has to be done by somebody else. But because my concentration now is up to 90% on my tremor and trying to control it, and I'm thinking the word Parkinsons all the time, I'm not terribly, I'm not concentrating on my conversation with you at all. Okay. I thank you every morning to at least somebody thanks you.